The World Health Organization, WHO, recently classified Mpox, formerly known as monkeypox, as a public health emergency of international concern due to the alarming spread of a new and more dangerous strain of the virus in Africa. This strain, known as Clade 1b, has caused outbreaks in Burundi, Kenya, Rwanda, and Uganda since July, resulting in over 570 deaths. Cases have even been reported as far as Sweden. The new strain is highly contagious but appears to be less deadly compared to other variations of Mpox. A 40-year-old man from Bujumbura, Burundi, named Ahida Rambona, who contracted the virus, shared his experience of dealing with excruciating symptoms. According to him, the disease caused severe pain, especially in the swollen lymph nodes in his throat, which made it difficult for him to sleep. The pain then spread to his legs. The virus is predominantly transmitted through heterosexual contact, and Mr. Rambona suspects he contracted it from a friend with visible blisters. Mr. Rambona and his wife, who also contracted the virus, are both receiving treatment at King Khaled University Hospital. The hospital is overwhelmed, with 59 of its 61 available beds occupied by Mpox patients, a third of whom are children under 15. The hospital has resorted to setting up tents outside due to the growing number of patients. Dr. Odedin Saviyamana, a doctor at the hospital, described the dire situation as the facility struggles to accommodate the increasing patient load. The lack of resources is a significant challenge. There is no vaccine, testing kits are limited, and the country has only one laboratory capable of testing for Mpox. Delays in diagnosing new cases exacerbate the situation, as lab teams must travel to collect samples, which slows down the response. Public health officials, including the National Director of the Center for Public Health Emergency Operations, Liliana Kangarutsi, are deeply concerned about the situation. She emphasized the challenge of timely diagnoses and the lack of awareness among the population. Many residents are unaware of the severity of the outbreak, with some continuing their daily activities despite the risk. Efforts to contain the spread are hampered by insufficient public awareness and limited access to basic necessities like water, which makes it difficult to maintain hygiene in cities like Bujumbura. Despite the fear of infection, many people are forced to continue working to support their families, highlighting the social and economic challenges that compound the health crisis. The situation in Burundi underscores the urgent need for international support, increased resources, and public awareness campaigns to control the spread of Mpox and protect vulnerable populations.